Good day, everybody. This is Mohammed Harbi, the Vice President of Saudi Anesthesia Society, and I'm speaking to you today from Saudi Arabia. I'm really honored to represent the Saudi Anesthesia Society, to collaborate with that society for the advancement of geriatric anesthesia. The geriatric populations are of special consideration, and many health system nowadays pay really a close attention to the management of those special patients. The physiological changes of ages will affect the whole system in the body, starting from the brain, cardio and respiratory system, down to uh, vascular system and all part of the bodies, which in general will affect the management of those patients. They should be treated in a special way. They should have a special consideration in the pharmacology, the technique that we are doing on a daily basis of anesthesia practice. Worldwide, geriatric population has really dramatically increased in the last few years, more than 65 years of age, and expected to grow. In Saudi Arabia, the situation is almost the same. Although the latest prevalence of geriatric population is about 3.5%, but this will be doubled most likely with the 2030 and maybe triple in 2040s and so on. So with that, the vision of Saudi Arabia in 2030 to really have a global management of many aspects, including geriatric population. The healthcare system in Saudi Arabia is free for the citizen, and it has some also another part with the insured patient and some other categories, but it supports all age groups. The geriatric population has also part of that, and this will hopefully improve their outcome and improve their safety. The commonest procedure that we see in Saudi Arabia for geriatric population are total joint replacements, laparoscopic cholecystectomies, cataract surgeries, and also we see a few malignancies related procedures. Those patients require a special attention and special management. One of them is the geriatric verification programs and other things. And those were aimed to reduce the post-operative complication in the form of morbidities, mortality, and also cognitive dysfunction. As you know, the cognitive dysfunction in the post-operative period is very common in the geriatric population, and it might actually last months or years. And this is would like to prevent that from happening. The current guidelines for geriatric population is not very well established. Uh, we have some collaborative efforts from many hospitals in Saudi Arabia and under the umbrella of the Saudi Anesthesia Society to generate some protocols and pathways, and that's need an area of improvement. So the research in this category can be very highly impacted on a patient outcome. I think the collaboration between the Saudi Anesthesia Society and the Society for Advancement of Geriatric Anesthesia will be paramount. And we're really happy to work together, to have many research, to have many guidelines, and also share expertise in the form of physical visit and having conferences, and we are really happy to do so. With that, I would like to thank you for giving me this opportunity, and we promise all together to make sure that our geriatric population are of importantly as important as younger population in their management and to reduce their post-operative complication. Thank you.